I'd like to discuss the integrated health program that we do here at the Ohio Neck and Back Pain Relief Centers to eliminate back pain through non-surgical spinal decompression. The reason we use it is because we've gotten great results over the last several years, and you can just see through some of these testimonials as to what kind of pain people were having before and after decompression. Now, there's different options for severe neck and back pain. That can include surgery, injections, carpal tunnel surgery for those with pain down into the arms and hands, surgery for sciatica, pain going down the legs, or non-surgical spinal decompression. Now, what can it cost if you choose surgery? A couple things that can happen is a syndrome called failed back surgery, where you have the same or worse pain afterwards. Just short-term relief. A lot of surgeries only last 2 to 5 years. Permanent nerve damage if there's any kind of mistake made. Scar tissue, which will definitely build up after surgery. And possible no relief because the person refuses to have back surgery. Now, we can take the toughest back pain and help virtually 80%. If you look, we only take qualified patients that will respond positively, determined through orthopedic tests and imaging. You get to create more life and less pain with non-surgical effective solutions, and you don't have to worry about the harmful effects of surgery, pills, or the injections. Now, our purpose, we are dedicated to be the undisputed leader in the elimination of severe neck and back pain using non-surgical procedures and the best possible solutions for neck and back pain in our community. Now, let's just look at the research to see what's the differences between injections, back surgery, and decompression. Now, one study on injections says that based on the available evidence, the Therapeutics and Technology Assessment Subcommittee concluded that epidural steroid injections may result in some improvement in radicular lumbosacral pain, which is pain that shoots down into the legs from the low back when assessed between 2 and 6 weeks following the injection compared to control treatments. So the average magnitude of effect is small, and generalizability of the observation is limited by the small number of studies, highly selected patient populations, few techniques and doses, and variable comparison treatments. In general, epidural steroid injection for radicular lumbosacral pain does not impact average impairment of function, need for surgery, or provide long-term pain relief beyond 3 months. Their routine use for these indications is not recommended. And number 3 is that there is insufficient evidence to make any recommendation for the use of epidural steroid injections that treat radicular cervical pain. So we're talking about neck pain that causes irritation of the nerves that shoot out into the arms, hands, and fingers. So, as you can see, this is out of Neurology back in 2007. Now, there's a study on surgery outcomes in the journal Spine done by Dvorak, where et al. They reviewed the long-term results of a patient that had received surgery for lumbar disc herniations. They reported that of the 575 patients studied, 70% still complained of the same back pain. Of those, 83% complained of constant heavy pain, 45% have a residual sciatica, pain down the leg, 35% are still under some kind of treatment, 47% are receiving a disability pension, and 17% are required repeat surgeries. Again, that was in Spine, Volume 13, Number 12, back in 1988. So let's look at non-surgical spinal decompression and some of the research done. First of all, the bad news about decompression is that it takes time. It's not an instant cure. If you really want to heal a disc, if there's a herniation or a bulge, it does take time. It costs money. It's not covered by insurance, so it can be as low as $124 a month, and it doesn't help everybody, only 80% of those who qualify. So the efficacy in the scientific literature for the treatment of cervical and lumbar pain by decompression is shown here. Results show that 86% of the 219 patients who completed the therapy reported immediate resolution of symptoms, while 84% remained pain-free 90 days post-treatment. Physical examination findings showed improvement in 92% of the 219 patients and remained intact in 89% of these patients 90 days after their treatment. And that is in the Orthopedic Technological Review back in November-December 2003. Efficacy, again, we see in cervical and lumbar pain. Serial MRI of 20 patients treated with the decompression table shows that in this study up to 90% reduction of subligamentous nucleus herniation, so herniation of the disc, and 10 of 14. Some rehydration occurs detected by T2 and proton density signal increase, and torn annulus repair is seen in all. So rehydration in some and annulus repair seen in all. So that was done by Dr. Eierman, and the evidence of non-surgical mechanical reduction, rehydration, repair of the herniated lumbar discs, in the Journal of Neuroimaging, Volume 8, back in 1998. And this, let's see, this one was done by Sheely, New Concepts in Back Pain Management, Decompression, Reduction, and Stabilization, and Pain Management. According to a study in the American Journal of Pain Management, the decompression method provided good to excellent results for 86% of the patients with herniated or ruptured discs and 75% of the patients with facet arthrosis. So you can see here, this is a herniation. These are the bones, these blocks here. In between are the discs, and you can see the herniation here. Down here we see the top, see it from the top, and this would be the back, and you can see it herniating here. And this is after 17 spinal decompression treatments, and you can see the difference where it's pulled in, and then again here it's pulled in here as well. So spinal decompression is not the same as traction. MRI studies show this, that regular traction does not return herniated disc material back in the disc, while spinal decompression does return herniated material back into the disc. And we use the Triton DTS unit because the Triton DTS unit is made by one of the most technologically advanced companies, Chattanooga, in the world. We use state-of-the-art rehabilitation from exercise, traction, wobble chairs, just the state-of-the-art equipment that's available. Our clinic focuses on disc pathologies, radiating pain, and spinal rehabilitation.